The number of COVID-19 confirmed cases in Africa has risen now to more than 10,000, and unfortunately 500 people have lost their lives. Initially, these were cases imported by visitors from the hotspots around the world, from Asia, from Europe very much, and also from North America. Several interventions are very important because we have seen not only the increase in the number of cases, but also the geographic spread beyond the capital cities where this started in most countries into the hinterland, the districts, local areas. So one of the most important things that has to happen is that the response that is being put in place need to expand beyond the cities to the local level, through provinces, through districts. The most important interventions continue to be those that are to limit the spread of the virus, meaning identification of cases, following up of their contacts, ensuring that both the contacts and the cases are isolated or quarantined, and then making sure that the provisions are there to provide care and treatment for those who are ill, and also to educate, inform the public so that they take precautionary and preventive measures such as hand washing, social and physical distancing when necessary, and ensuring that we limit the spread of the virus. We have worked very hard with all of our member states and our partners to support countries. We have sent experts to the countries to support key areas such as, first of all, coordinating this response, ensuring that the mechanisms are in place to react quickly, to improve surveillance, to identify cases, to improve contact tracing, to make sure that the provisions are there for care and treatment, and most importantly, to ensure that the public is well informed, that people understand and feel empowered and enabled to play their part to limit the spread of the virus.
Africa still has an opportunity to reduce and slow down COVID-19 transmission. Early isolation of all cases, including mild cases, is one of the key control measures, along with early detection, early treatment, and contact tracing. Timely and accurate epidemiological data is one of the most important tools to inform the response. We must also protect our healthcare workers and ensure that they are appropriately equipped. There is concern about the impact of the pandemic on countries with fragile health systems and those experiencing complex emergencies. Some countries in Africa may not have adequate intensive care unit capacity, such as beds, ventilators, and trained personnel. The international community should extend technical and financial support to these countries to enhance response capacity to minimize the spread of the outbreak. WHO is working across Africa to deliver essential equipment, train health workers, clinicians, and public servants on how best to respond to COVID-19, and to tailor a global guidance to challenging local context. We are working to address global market shortages and ensure reliable and equitable distribution of essential supplies and equipment to low and middle income countries, including those in Africa. It is critical that countries do all they can to prevent this pandemic from intensifying further. This means a strong public health response by every arm of government and every part of society.